My name is Thanh Hoang. I'm the Program Director for the Endocrine Fellowship at Walter National Military Medical Center, Bethesda, Maryland. And since I'm the Program Director, I'm in charge of all the fellowships. So we do kind of different things beside the bone. We also do thyroid, parathyroid, transgender. So it's very general, different things. But we've seen Osteogenesis Imperfecta patients in our clinic. And Dr. Shakir, my colleagues, also my mentor, also work with many of them as well. So it's a genetic syndrome. It has a different spectrum with different mutation in different gene of the collagen. And there's so many different types. The clinical diagnosis, usually these patients have multiple fracture when they were younger, and a dental issue and different cardiovascular issues as well. And then on physical exam, there's some feature that you can look for, like blue sclera, history of multiple fractures, just like our patient, multiple fracture when he was 2 years old, and then keep having recurrent fracture as adult as well. And then family history as well. His sons, his brother have similar feature with fractures, and some of them got diagnosed, some of them haven't been diagnosed yet. So based on the history, physical exam, and lab finding, genetic mutation can confirm the diagnosis and tell you what type of osteogenesis imperfecta. So currently the patient was treated with Romosozumab for 12 months and then 1 dose of reclass, and he's been doing well with no recurrent fracture. So this is a patient, Dr. Shakir saw him first. He's a 64 years old male with a history of coming in for osteoporosis. He has severe osteoporosis and history of fractures. At age 2, has multiple collarbone fracture and then wrist fracture, and then it was treated with alendronate, which is the standard treatment for osteoporosis. It's a common, Fosamax is a brand name for that. Usually you take it once a week, 70 milligram once a week, and for most patients they do well with that, but then he not improving with that. So Dr. Shakir decided to treat him with Romosozumab, which is it has some anabolic bone building characteristic, and that's injection every month for 12 months, and then after that you have to give another treatment to follow. And we decided after Romosozumab we do IV reclass, and he's been doing well so far, right? Yeah. So next step, I think we just monitor, follow up with him clinically. So clinically, we'll make sure he's doing okay. Any sign of bone pain, any frequent fall, any fractures, and then we follow with monitor with the follow-up DEXA scan to look at his bone density, make sure it's improving or stable. So I think this is just a new treatment. There's not a lot of research and regarding this. Usually bisphosphonate is the mainstay for osteogenesis imperfecta or surgery if they have severe fractures. So this one could be something that clinicians can consider if the patient failed the general standard treatment for osteogenesis imperfecta. Is something that they can consider.
I'm Captain Mohamed Shakir. I'm a retired Navy captain. I did 28 years in the U.S. Navy. After I retired, I joined Walter Reed. I'm a professor of medicine at the Uniformed Services University of Bethesda. I'm interested in osteoporosis, and we see a lot of patients with osteoporosis, and we see once in a while osteogenesis imperfecta. Till now, we are frustrated. Of course, the patients are more frustrated than us because there is no current treatment. We give all these bisphosphonates, denosumab, all these medications, still they continue to fracture. So right now, the new medicine is available. So that's what I got interested in this medication for this patient. This is one medication has effect on both bone resorption and bone formation. Most of the other medication has either effect on only on one aspect, either on bone resorption or on bone resorption. It does not have combined effect. This is the only medicine which combines both effects. So hopefully we thought this will work much better than the other medications. We want to do a clinical trials depending on how things go at Walter Reed. That's what we want to do it. And we need long-term follow-up also on this patient. But the patient is very happy. For the last 2 years, he does not have any fracture. He continue normal activities, and he want to do some skiing and all the things. He can do that right now. The practitioner is patient with osteogenesis imperfecta. This is a new medication worth trying for this medication, because this is approved for medication, and probably this is not approved for this particular disease, but once the FDA approves a medication, the physician can use it for other indication. So you should try that in patients with osteogenesis imperfecta. The invention of medications are marvelous, and it is every day we see all these medication comes, and the medicine is so expanding, and we are thankful to all the researchers, all the clinical trials, and for all the pharmaceuticals to make all these medications.